Hi everyone, welcome to session 2. Hope you enjoyed last week's session. Today's session is the fun topic about theoretical frameworks and process evaluations, and we're covering these two learning objectives. So the first one is understanding the process for which a process evaluation is undertaken, and also helping you articulate the strong research questions to be answered in process evaluation. A little bit about the session. We'll cover kind of three areas. One about why we should learn about theoretical frameworks. This will have kind of examples of operationalizing some of the theoretical frameworks throughout, and we'll have a discussion. On my own journey, I guess when I think about theoretical frameworks, to make it quite simple when we think about your own projects, is that really it's about the theory of change. So theoretical frameworks, exactly as how some of you have said, it builds on the established knowledge, real life experiences, provides guidelines, is that it provides a kind of systematic and comprehensive way in terms of thinking through your project and your intervention so that you can think through the theory of change. What is it that you're trying to achieve? How will it achieve it? And what are some of the outcomes that will happen short term, medium term, and long term? In the literature, there's a lot of different literature. When I was reading on it, I sometimes got a bit lost. But over time, I think the important thing, as some of you have alluded to in your answer before, was that it can build on existing interdisciplinary knowledge. So it's really trying to draw on social sciences, trying to draw on other theories that's been built and observed over time and developed as a time. So in choosing the relevant theoretical frameworks, you're building on the depth of knowledge and theories over time. The third thing is that it can build on lessons learned, how and why something may happen. Again, it's kind of, if you think about the theory, it's almost like that distilled knowledge base over time that you're building on. So again, theoretical frameworks kind of helps you think through for your own projects, the theory of change, why something happens, how, what are the outcomes that you want to look at. It builds on the interdisciplinary knowledge as we work together with different people across disciplines. You have the lessons learned, how and why something may happen that you're building over time, but it's very important to contextualize, and it can help to be systematic and comprehensive. So those are some of the reasons why I think theoretical frameworks are helpful to learn about. However, having said that, there's a word of caution. So it is not a cookie cutter. You're not just taking it off and using it in your project. You have to really carefully think through, is this applicable for my setting, for my context? Am I actually building on knowledge systems learned before that's relevant for us? Because a lot of you mentioned culture as well, for example. It can introduce a bit of unnecessary jargon, like even just understanding a term might be overwhelming. So something to think through, especially when you're communicating with your stakeholders and with the research team. There's a lot of choices and can be overwhelming. I have felt that way over the last few years. And sometimes there's too much detail. So they might go through all these details describing one item, let's say coherence in normalization process theory, that you can actually miss the focus or miss your actual findings on the ground as to what is the key thing. And lastly, it is a theory. So it's meant to be this theory where you check your assumptions, check with the stakeholders on the ground and see what happens. However, having said all of the caution, it is important because just like this diagram here, or this figure here, these two guys are saying something happens, then a miracle happens, and then we get the result. So we need to be a bit more explicit in the middle as to how you think that theory of change will happen, and theoretical frameworks can support that journey. Going back to the UK MRC figure here, again, program theory is the core element in that whole design. So the feasibility, evaluation, implementation, development of intervention, but in the middle, that core element, they'll say context, develop, refine, and retest your program theory while engaging as stakeholders and refining the intervention. So again, thinking through that theory of change, as many of you have in your projects already, and retesting it and knowing why you think something will happen is crucial. A little bit about that jargon out there. So you probably have heard the things about theories, frameworks, models, and I'm really no expert, but I'm just trying to provide this high-level overview so as you go through literature and when you think through for your own protocol and with your teams discuss what might be relevant, to know that there's lots of different wording out there, But Nilsson was the author of this paper here, Making Sense of Implementation Theories, Models, and Frameworks, has kindly published this paper in Implementation Science, where they did a review of what was in the literature and kind of grouped it across these three. So they thought process models can help you guide the process to translate research and practice. So if that is your aim, then that could be something that you look at. The evaluation frameworks to help evaluate the implementation. And then there are those classic implementation theories as well as determinant frameworks that describe or explain the influences on the outcomes. So this is often social sciences or others where they've defined this theory that's built on a wealth of knowledge that they think is what explains it. And it's very helpful in terms of when you're new to certain things to read up on these theories, because it can inform how you understand your intervention. I'm just gonna highlight a few kind of examples that I've used in the last 10 years with different projects, and just to give you that, I guess, sample of different things that are available out there amidst a lot of other things. But I often find that at that individual and micro level intervention. So if you're trying to change knowledge, attitude, behavior of an individual, of a community, that behavior change wheel is quite helpful. So behavior change wheel is this figure here, where it's looking at capability, opportunity, motivation, and it breaks it down. If you think about, psychology, physical, social, physical, reflective, and automatic. So it's really trying, and if we read the descriptions, it's trying to break down these three categories for why someone would do something. It's not just about whether you might be motivated, but do you have the opportunity to do so? And are you actually capable of doing it? So in some of the kind of rehab trials I've been involved in, this is quite helpful, because you think about capability, for example. Do you have any disability? Is there psychological impact? And so you might work on motivation, for example, for the patient, but then if they have no capability, then you have to think through what are some other things that you need to put in place. It then has the broader kind of areas of environmental restructuring, restriction, education, and then the broader kind of contextual things that you might either introduce together into an intervention or be aware of, those categories that have to be in place. So I think some of you said that you want to have policy change in your project. So you have to think through, well, is it fiscal measures that you're going to have change in? For those with environmental health projects in the Global Center, then, is it the environmental social planning that you're going to change with the policymakers? So again, gives you that kind of systematic way of thinking through and how they interact with each other. So my thoughts on this in previous use has been that it's comprehensive, but it is quite complex, but it was very helpful when we used it in a process evaluation of salt substitutes in a community in China to actually think through just capability, opportunity, and motivation in terms of whether they could actually use the salt substitutes and why they would use it in their families. This is a link to the paper if you're interested in how do I operationalize something like the behavior change wheel in my process evaluation. That might be a helpful example. So that's at that individual level. And going back to that Menti question of that, are you trying to make change maybe at that organizational level? I've found that normalization process theory can be quite helpful. And that's because they have a real focus of kind of integrating and embedding an intervention to routine practice. A little bit of history about this. This was developed in 2003 to 2007 and was actually based on researchers looking at telehealth interventions and doing qualitative research and analyzing it and doing synthesis and coming up with themes, and in which they came across they grouped into 4 kind of main findings about coherence, cognitive participation, collective action, and reflexive monitoring. Remember when I said jargon? I think to me, the words just by itself is very hard to understand, but then they'll give the definition. So coherence is sense making. Do you believe in your intervention? Do you believe that using the Smart Health app will make a change, for example? Cognitive participation, if you do it, can you actually do it? Can you activate it? And what happens from then? Do you see a bit of feedback to say, oh, it does help? Collective action relates to yourself and your group, and organizationally, let's say in a hospital setting, was that there's a nurse do it and then the doctor does it and then they feel that it works together. So it comes back to that collective action and how people work together. And then there's reflexive monitoring, whether they learn whether there's a feedback loop to say, oh, it works. So we can put it into our systems and make it work and embed it into our day-to-day life. So in some of the projects that we've done so far, I found that normalization process theory has worked quite well in interventions where you're trying to do organizational change, because you are building on lessons learned from this previous research in telehealth. And Menglu will share more in her case study. At that macro level, that policy level, one of the kind of institutional frameworks that I have used with another researcher called Shay was actually looking at the cardiovascular polypill. So remember last week, I think I said my PhD was in process evaluation of the fixed dose combination in 2015. And after that, we were thinking, okay, well, we've done this trial, we've shown this evidence, has it been embedded into practice? And of course, as we all know, health systems, as you all said, the contextual factors is a lot more complex than that. And this institutional framework was helpful because it breaks down the different levels of the institution and the governance, but it also breaks down over time what Williamson has learned about the frequency of change. And that's important because when you think about your short-term impact, medium-term impact, long-term impact, you don't want to overreach and think, I'm going to have amazing impact in cardiovascular disease because of fixed dose combination, because actually all these other implementation things that have to happen before that's that change. So for example, when Shay and I went to do some interviews, I think 3 years ago now, to ask what happened to a fixed dose combination, we realized that yes, at everyday exchange with that market, it would like, does the patient like it? Will they buy it? But then is it actually available in the market? And in Australia, it wasn't, because it was a trial medication. Then you think about the organizational structure. Well, was it in the guidelines? Can it get through your kind of therapeutic goods administration? And then there's that organizational structure and their own ways of thinking through things in terms of, is it cost effective? How much does it take for the government to pay, etc. So there are all these organizational structures that will take more to move. And then you've got your higher level formal institutions, such as, let's say, a WHO body. So one of the questions we also asked was, has the fixed dose combination been embedded in the World Health Organization essential medicines list that gives recommendations to individual countries as to what medications are essentials? And it's only been last year or so, so about 10 years, that this sustained advocacy with the evidence has actually made a change. So when we used the institutional framework, it actually made sense when we looked at what actually transpired, that a lot of that theory, that institutional theory about governance and things, was actually alongside this in terms of frequency of change. And then also importantly, when you think at that more higher level things of deeply held social beliefs or cultural beliefs, if your intervention is trying to change something that is so embedded, you might have to be a bit more realistic to think it's actually not that easy to happen, because it's likely to be slow in terms of that change in culture, or you need something that rapidly changes it, like a war epidemic or leadership. Or on that global level. So again, at that macro level, if you're trying to make policy change or cultural change, it's helpful to build on these kind of theories in which social scientists have kind of over years learned about frequency of change and how that could impact the actual impact your project's trying to have on the ground. That's the link to that's the reference to that paper if you're interested. I thought I also just quickly highlight NAS. So NAS is by Trish Greenhall. And again, it was looking at all these studies of digital interventions, implementation studies, qualitative research. And they're saying, well, why does something not get adopted? Why she was theorizing, why is it not adopted? Why is it actually abandoned? What are the challenges to scale up? And these were the things that she came up with. Condition. Is it diabetes? Is it cardiovascular disease? What is it? What's the social cultural factors around it? You know, what do people think about why they have stroke or cardiovascular disease, for example? This is very specific for technology and social intervention. So technology itself, how do you make it? Do we know how to make it? What's the supply model? So there's a few more kind of components specific to technology. And I think some of you might be doing technological intervention. So this might be a helpful framework. And then different from others, they also have the value proposition, supply, demand. What's the value of it to the different actors? And then you've got the adopters, so the staff, patients, carers, and you've got the organizations that have to put it to work. So as many of you said, the health system will be a context that will influence your implementation. So important to think through what are people's capacity to innovate, readiness to change, organizational behavior, what's the feedback loop that you need to embed it into the system. And over that, there's always this kind of continuous embedding and adaptation over time. Within, of course, the wider political context and regulatory systems and legal systems, professional guidelines and bodies. So it's a helpful framework to me because I think it really it zooms in on complexity about condition, technology, value proposition, and again, says you need that kind of continuous embedding and adaptation over time. It also brings in things like implementation costs, because when you think about value proposition, who's going to pay for it? Who's going to pay for that app? Who's going to pay for the iPad if you're going to use it? And who will value it? So it's quite a nice iterative kind of framework if for those who are maybe thinking about theoretical framework for digital interventions. Now moving a little bit to evaluation frameworks. So remember I said there was theories and models and evaluation frameworks. I think most of you would have heard of REAIM. REAIM, I think, became mandatory in some of the GACD projects maybe 5-6 years ago. And REAIM stands for Reach, Effectiveness, Adoption, Implementation, and Maintenance. And it really came about when you read a bit about the history of it, was you had a lot of cancer trials and they'll come up with some kind of evidence, but then they'll say, well, is this pragmatically translatable to your wider population? And therefore, that's where REACH came about. Who are you reaching? Who are you actually recruiting into your trial, into your research? And is it reflective of your general population? And then they came up with the other things about adoption and use in the actual health systems. REAIM has now moved over time with researchers recognizing the importance, researchers and implementers recognizing the importance of context. So now they've got context included in there, and again, fit and co-creation about your program or your policy and implementation strategies. It also now addresses equity issues, because when you think about the context in terms of whose perspectives are being represented, are you planning to ensure equity is addressed? And then in the actual representation of the outcomes, but also the reach of your population, a very kind of dedicated focus on equity and representation. And then also looking at unintended consequences. So they do have kind of interview guides, templates that you can use with PRISM frameworks, but again, it can be very thorough. And so you have to think through which ones are relevant and can actually be operationalized in your study. I thought I'd talk briefly about realistic evaluation. This has been by Paulson until 1997. So it's really been the kind of, from my understanding, the basis of that whole theory-driven evaluation. And it was based on their observations about people's change in behavior when they were put in different contexts. So whether they were in a dark neighborhood, whether in a safe neighborhood, compared to their behavior in a comfortable and environment that they don't perceive as dangerous. So it was observations based on people's behavior in different kind of contexts that came up with this. What's the context? What's the mechanism of human behavior? What's the reasoning behind people's thinking, and what's the outcome? So what change in behavior will happen? And it's a kind of theory-driven evaluation where the context is at broader conditions, but it's also very mindful that context keeps changing. So in a lot of the realist evaluation, they'll say at this point of time, if a trigger happens, what happens to the context and how will it change the mechanism to result in different outcomes? So it's quite a complex way of evaluating, and very much used in the UK, and I think used in the school-based complex interventions as well over time. There are kind of guidelines if you were to do it properly and rigorously, and that's in Ramsey's project.org if you want to read more about it. But that's a very broad, high-level overview. And I think because of that realist evaluation of complex interventions since 1997, it then became part of the UK MRC guidance framework, because the key researchers looking at complex interventions at that time was using realist evaluation. So you can see the mirror there of context and mechanisms impact with the outcomes, but put in more kind of logic model sense. And we've gone through this last week. So that's the process evaluation of context, implementation, and mechanisms of impact. So all of that to say, there's lots out there, and I only really just touched on a few kind of frameworks and theories that I've used with different collaborators. And I think it's quite important to choose wisely if you were to use a published theoretical framework that and how you would use it. So it's a few things to consider. What's the aim of your research, your overall research? Is it implementation research? Is it efficacy? What's the aim of your process evaluation? Are you more concerned about fidelity, context? Are you looking at everything? What's your study design? Is it, for example, like Menglu's one, step wedge? Is it observational? What's your study population? Are you including equity issues? Are you what are you looking at? Your study setting, is it across different countries? Is it across different villages? How would the setting impact your actual evaluations pragmatically as well? And then the intervention components and complexity. And I think Renu raised it last week about the complexity of the intervention, something you have to consider in the process evaluation, but also in your kind of theory of change. And then importantly, your collaborative research team. So what's the training experience? How would you communicate some of the tools that you want to use and the ease of use behind it? And fundamentally, I think if you distill it all down, at the end of the day, you do just want you want a theory of change that your research team understands, your stakeholders all are on board on, and have come up and co-designed it with you of why, how your complex intervention will have an impact on, what are those contextual factors that's going to impact it, and which ones you have to be aware of, and those causal assumptions. Again, high level overview. I hope that didn't confuse you, but it just gives you a bit of a taste, but also for those as you start on your protocol to think through what's your theory of change, are there relevant kind of theoretical frameworks you want to read up on or use, and as a group, individual project groups discuss that. So I might now hand over to Menglu for her to shed a bit of light on her use of normalization process theory in Interact 3 process evaluation. Thanks, everyone. And then we'll take questions after Menglu's presentation.
Thanks, May. Okay, so probably someone of you already know Interact 3 from last session. So it's the study design, as May mentioned, it's an international multi-center and step wedge trial. And intervention is a complex intervention, include multiple components, and also it requires a change on the organizational level because they're going to use the intervention as a routine practice after going into the intervention phase. And also because it's a multi-center cluster randomized trial, we have some context difficulties, including like different health systems in multiple countries, as well as some local characteristics, which is different across the centers. And also, most importantly, the study design is a pragmatic design, and we require a consecutive enrollment of the patients, which means all the patients that are eligible to be included, they have to receive the care bundle, which is the intervention, when they roll into the intervention phase. Next slide, please. Okay, I think the one before, yeah. So based on this, we developed a implementation research logic model, and we considered the different determinants that I mentioned before with the intervention characteristics. It's a complex intervention. And also with the setting difference, it's all about the local characteristics and also the health system, as well as consider the characteristics of the individual participants. And also the process that involve multiple departments to collaborate to make sure every patient admitted into hospital will receive the intervention as a routine practice. So based on this, we designed to use two frameworks and also the theory, the MRC guidance framework, to understand the implementation of the intervention, and also to explore the context and the mechanisms from the intervention to the outcome. Because this is pragmatic study and we're using the care bundle, the intervention, as the routine practice, so we really need to understand what are the important factors that influence the integration of the KL bundle. So therefore we selected the normalization process theory, which will provide a deep understanding of the embedding of the KL bundle as a new mode of care in the intervention. Next slide, please. So, in summary, the way we choose normalization process theory because it's suited as to the study design and also to the intervention design as well, because we want to understand the organizational change. And also it helps us to better operation on this trial, because the normalization process theory will provide some information regarding how can we better adopt and also embed this practice in the routine care, and also therefore help us to assist the operation team and also the sites to embed this care bundle in their workflow. And also this help us to inform future process evaluations in stroke units, such as once we understand what are the important factors that influence the practice, then when we design the process evaluation and also the future interventions, we will consider like what are the important characteristics should we consider before we actually roll out the intervention. So the detailed design of the process evaluation and the use of the framework and theory has been published in the as a protocol in the Frontiers Journal. So if you are interested, I think it's been embedded as a kind of additional resources for you to read. Next, please. So I think the key message for this session will be first, the theoretical frameworks help us to think through like what are the theories to change, and also to consider the context and the mechanisms to action to achieve the outcomes, what we set for the clinical trials, and also from the implementation outcomes. And also it can help to build up the existing knowledge, and also to keep it simple and guide the evaluation of the implementation. So when you choose the theories and frameworks, I think the most important thing is to understand, to think about the complexity of your intervention design, and also the feasibility of your team to do the process evaluation, and also as well as your resources. Because some of the theory and also frameworks requires like data collection based on different indicators. And also the most important is to think about what is your theory of change. And this will give you a deep insight on which framework would be choose. And also it's important to co-design it with those who are experts and have experience within the process evaluation, as well as a better understanding and for the rationale for the whole trial or for your own project. Next slide. Okay, so I think now we have probably 20 minutes to discuss, and we would like to ask some questions and for you to think about what would be the theory of change of your project, and if there are any theoretical framework or model or theories you know or you would like to choose for your process evaluation in your project, and tell us why or why not. Thank you.